Hi, this is Dr. Kim, and you are probably wondering what can be done about my pain after my plastic surgery. So, there are a couple options here, but we're going to talk about what you need to know beforehand, what I do during the procedure or while you're asleep, and finally, what you can do after plastic surgery to get the best results. One of the things about plastic surgery in general is anxiety. So, I think that increased anxiety gives you more pain. So, how do we reduce that? Educate yourself. Learn as much as possible, ask your plastic surgeon questions, and learn about not just your plastic surgery procedure, but also the recovery. I do think that really helps to reduce the amount of pain that you feel after your operation. Obviously, you should know your own personal pain tolerance. So I do think that helps. Discuss that with your plastic surgeon as well. But having a higher or lower or average pain tolerance will help guide the plastic surgeon as well as yourself as to what to expect. Before surgery as well, there are some non-surgical things that you can do to actually help reduce pain. I think that preparation is key. So in other words, prepare your bedroom and prepare your house or apartment. Prepare who's helping take care of you before your surgery. If you don't have to worry about that stuff, the better off you are. So get ice packs ready. Have a clear path to the bathroom. Make sure that whoever's taking care of you for the first night or whoever's picking you up from the surgery center is going to actually be there and is reliable. Make sure that you have the ability to eat well after surgery, including increased protein, and all of that is taken care of before your operation. Make sure that you have Netflix, laptop, books ready to go after your operation. And as you can tell, there are a bunch of other things you probably need to do and prepare for after your operation, but the more you know ahead of time, the better off you are afterwards. I think the final thing to mentally know is something we all know. Pain is temporary. So in other words, yes, common sense is going to tell you that you're going to be in a little more pain right after your operation. And as the days go by, you're going to be in a lot less pain. Just realize that the amount of pain you're feeling right after your operation is probably going to be the worst. If you get through the first night, then the second night, third night, and other nights get a lot easier. And of course, we don't even want you to have that much pain the first night. So discuss it with your plastic surgeon, and there some steps which we're going to get to in just a moment, which will help reduce that first night's pain. Now, during the surgery, of course, you're probably asleep or sedated or out of it. And even if you're awake, you don't know what's going on. So there are things that I do as a plastic surgeon to help reduce that pain. I think the biggest thing is the ability to give you numbing medicine that lasts for 72 hours. So at the end of your operation, I will inject regionally numbing medicine all over the place, and specifically regionally, like in terms of nerve blocks or in the generic area that you had surgery. This medicine is awesome. It does last for 72 hours or 3 days. You're still going to feel pain or maybe soreness, but it's a lot less. You definitely may need narcotics or strong pain medicine, but typically most of my patients don't even take that anymore after their big operations. So you'll be asleep, of course, on the operating room table or maybe a little out of it, sedated, and I can give you that numbing medicine exactly where I did the surgery. During the surgery as well, I do think the precise dissection of the surgical area, which is a nerdy term and something maybe you don't really care about, but of course, as a plastic surgeon, I want to make sure that I'm doing what I need to do, but not more than what I need to do. And I do think that helps reduce the amount of pain that my patients feel after their operation. After plastic surgery, you want to take it easy, but you still actually want to move around. So remember all that stuff that you prepared for your bedroom. That'll help because I think psychologically as well as physically, you don't have to move around as much and you're not worried about that stuff. In terms of moving around, I definitely encourage my patients to walk, go to the bathroom. Even if you need a little help, go to the bathroom with your friend, your overnight guest, and make sure that you go to the restroom and drink plenty of fluid. So the more increased circulation you can have after your operation, the quicker you're going to heal. We all know that reducing swelling helps to reduce pain. How do we do that? Of course, have ice packs ready. Certain medications by mouth help to reduce swelling. Lymphatic massage in certain areas may help to reduce swelling. But the biggest thing I think is body part elevation. So for example, if you have surgery in your face, you want to elevate your head, your face above heart level. That may mean sleeping on a pillow or two to elevate your back for a couple of days to help reduce that swelling. If you have surgery in your legs, you want to actually put some pillows underneath your legs above heart level, and that will help reduce the pain as well. So those things will definitely help reduce the pain that you feel after your operation. If you do need strong pain medicine, I would definitely try to keep ahead of the curve. I wouldn't wait until I have 9 out of 10 or 10 out of 10 pain and then take some pain pills. I would try to catch it when it's maybe 8 out of 10 pain, and that way it'll lower the peak of pain that you may be feeling. It's important to monitor it, and of course, if you're a little groggy, the person helping take care of you will help you as well. But taking pain medicine just to be out of it all the time actually really isn't that great. You want to take enough so that you're not in pain, but you don't want to take so much that you cannot walk around. Improve circulation, be aware of your surroundings. All those things actually help with healing, so you want to be able to do those things and not be completely sleeping right after your surgery for hours or days on end. So I hope that these very general suggestions help you to reduce the amount of pain you feel after your operation. Of course, I'm not your doctor, so always talk to your doctor about this. And you notice that in this video, I'm not being very specific because, again, it depends on exactly what plastic surgery procedure you're getting. Ultimately, you are responsible for your own comfort because as a plastic surgeon, as a doctor, I actually don't know how much pain you're in. I can ask you on a scale of 1 to 10, but ultimately that's up to you. We want you to be comfortable during the recovery process after your procedure. That way you'll heal up faster and definitely emotionally and psychologically feel better about the entire process. If you have any comments or questions, fire away below. Thanks so much for watching.